All right, well, it is 12:03. I think we can go ahead and get started. Thank you all for joining us, and we might have others joining us here soon. I will say that this meeting is going to be recorded, and just want to quickly introduce everyone that we have the pleasure of being with here today. So I'm Marina Martinez. I'm a program manager at the Washington chapter of the AAP. And I have the pleasure of working with Dr. Anisa Ibrahim, who is a Somali American pediatrician and director of the Harborview Medical Center of Pediatrics Clinic. And we are also here with Dr. Ahmed Ali, who is a pharmacist and is the executive director and founder of the Somali Health Board. It's been a pleasure working with you both, as well as the Somali Health Board. I see the passion in your work, and thank you for being here with us today and sharing some more about the Somali community.
Awesome. Thank you, Marina, and good afternoon, everyone. We are going to be discussing today addressing vaccine hesitancy within the Somali community. And this is a project that has been ongoing through our work over the last several years, but also right now is focused with the Washington chapter of the AAP that included community discussions and gathering some information about the vaccine issues within the community. I will be talking briefly about a couple of things, and Dr. Anisa Ibrahim will be able to continue that. In the past, the organization has done a ton of work, through especially the Somali Health Board, Dr. Anisa and myself, having conversations with the community about vaccine. We even produced a comic book that we call Talal and Talo, Talo Ya Talal. So conversations within the vaccine within the Somali community. But overview today, we're going to cover a brief cultural history of the Somali community here in the Pacific Northwest. Where do the Somali community come from? Why did they move here? And understanding your patients as healthcare providers makes it easier for you to be able to point some of their needs, particularly with the vaccine, understanding their culture, understanding some of the barriers that they face, and so forth. Review some of the vaccine hesitancy within the Somali community. What exactly does that mean? We'll cover that. And then some barriers and facilitators to vaccinations, because our focus here is vaccines. And then hopefully provide some roles for providers to be able to communicate effectively with their patients. We'll give a couple minutes towards the end for Q&A for anyone who has questions and answer questions. So the Somali community comes from the country, Somalia. As you can see here on the map, the seven-shaped area in the Horn of Africa is what's considered the proper Somalia. Geographically located in East Africa, borders Ethiopia and Kenya, and then the Indian Ocean and the Mediterranean, and Djibouti as well. However, ethnically, as a community, the entire region that is highlighted yellow is where the Somali-speaking community lives in the Horn of Africa and East Africa. So a large population lives not only in the country of Somalia, but they also live in Djibouti, they live in Ethiopia and northern Kenya as well. So oftentimes when you're talking to your patients, they might point out the different geographical areas where they come from, but they are all ethnically Somali. They speak the same language, the same culture, the same religion, just happen to be in different parts of the continent or the part of East Africa based on the previous colonial division during the 1800s petition by the Europeans. Somali is 100% Muslim, ethnically, Islamic culture as Africans, which they all share the same culture and religion, and nomadic lifestyle where they move from one place to another, from one region to another. Particularly the northern part of Somalia is very arid, it's desert. And so they have a very lifestyle where people move from one region to another. As a Somali myself, there's a lot of things I've been written, and I'm oftentimes drawn to that aspect of, people who have all they have is their lifestyle and their camels, and they move from one region to another. That's all their belongings, but they're very proud people. And for those of you who have interacted with Somalis, they oftentimes consider themselves to be very proud culturally. Folks, the women will have their attire and their gowns and the hijab on. The men also project their cultural heritage and so forth. They're also very well connected. And by this, we mean that whatever happens here in Seattle, whatever is discussed here in Seattle, most likely will make it to somewhere in Somalia or somewhere in Europe where the other communities live, or Minnesota. So very oral society, very oral oriented, and very well connected all across the globe. In a lot of presentations which I cover about Somalia, I would often like to include this image, a historic image of the pre-Civil War in 1981 up to 1990, before the Civil War, in which a lot of the Somalis, of course, left Somalia. Many of them settled in the West and other parts of the world, but there's still a sizable population still in Somalia. This was we considered back from my parents' age and other folks, paradise, or the Pearl of Africa, as it used to be called in those days. Beautiful, very nice place for folks to live and enjoy their life, but we was disrupted because of Civil War, and that's how we ended up in the Pacific Northwest. This is another image of folks who are enjoying their lifestyle in the Lido Beach in Somalia at that time. So the context about this, understanding the culture of your community that you'll be serving, is what are some of their background in terms of their religion, some of their education levels, what type of struggles they experience, and how does that fit into the patient that you're having in your clinic for about probably 30 minutes or so. The next section of this discussion, I'm going to turn over to Dr. Anisa Ibrahim.
Great, thank you so much, Ahmed. Dr. Ali. It's a pleasure to be here. Welcome, everyone. So just wanted to take a little bit of time to discuss the continuum of vaccine acceptance and how this applies to the Somali community. As Ahmed told you, I think the history of Somali people's migration is really important with regards to how folks have arrived here, and also the connectedness of a community. So good and bad news tends to spread. And as we've seen this with many different trends, we've also seen it with vaccine hesitancy and acceptance. So far and away, with over 10 years of community experience and partnership and education that Dr. Ali and I have done through the Somali Health Board, we've seen that most Somalis, again, it's a generalization, really fall within this middle portion of vaccine hesitancy, where many of them will delay, possibly refuse some vaccines, but far more are accepting, but a little bit unsure, and most are accepting. As a whole, the Somali community are not anti-vaxxers. They are not stark opponents to vaccines. And many of the times when they want to delay or not give a vaccine, it's tied to a particular concern. So I think knowing this specific history is important, because it really helps you think about, how do I need to start this conversation, and how do I need to engage with the person or the patient in front of me? Where do they lay on this vaccine hesitancy continuum? A lot of our work, especially in the beginning, but even now, really addressed, what is the community knowledge, what about vaccines? And far and away, we've seen that the majority of the community are familiar with vaccines. They report having received vaccines in Somalia. Some even report going out of their way, waiting in long lines to be able to get vaccines. So it's a familiar concept that many people have been engaging in for many years, even prior to migrating to the United States. Many of them, over multiple focus groups, including the ones that we just most recently did, are able to tell you how vaccines work and what a vaccine does, what its purpose is, and what is occurring once a vaccine is injected into your body, general knowledge. There is variable knowledge, however, about the specific diseases that vaccines are protecting against. So while some are very familiar with something like varicella, or busbus as we call it, or measles or jadao, they are a little bit less familiar with what rotavirus is protecting against, or what pneumococcal is protecting against. They'll be familiar with some vaccines specifically used for travel. So for example, everyone knows the name meningococcal because that's a vaccine that adults need to be able to perform Hajj. But if you were to ask specifically what disease is meningococcal protecting against, they may be less likely to know. So as Dr. Ali has said, the themes that we're going to discuss today came from both the 6 key family interviews that we did most recently in our partnership with the Washington chapter, but also based on over 10 years of community feedback and experience through the efforts of Somali Health Board. So these 3 there's main themes that we see that really recur over and over again when we have community conversations. And we really do like to call them conversations because when we have these conversations, it's not Dr. Ali or I or our staff at SHB presenting just to the community, but it is really a time for us to go break bread, sit, have tea with the community folks and really engage about, what are the concerns, what are the thoughts that are going through the folks' mind in the community, and really being able to express themselves in their language of comfort. A lot of the themes that recur and have been consistently recurring are these 3 themes. So first, there is rampant misinformation or disinformation regarding vaccines, particularly the MMR vaccine, and then also their side effects and possible side effects. There is a kind of underlying theme that comes up every once in a while, but it comes up at least once in every single focus group or community event, and that's the religious beliefs and how some vaccines may or may not contain things that are haram or impermissible in our religion. And then the third is really accessibility to providers. So we'll go a little bit deeper into each of these. So misinformation is something that I think is rampant in the community, and really it goes around the MMR vaccine. And I want to delve into this a little bit. I know we're talking about more than MMR, but in the community, this is something that will come up if you're taking care of Somali patients. So MMR vaccines, there's huge concerns that there's a connection to developmental delays or just developmental issues, particularly in speech. So these are 2 quotes that we took from the focus groups. And the first one really encapsulates what many of the community members believe. So they say, my main concern is with regards to the MMR vaccine and how it affects children developmentally, causing speech delays, especially in boys. The girls are far less affected, but definitely the boys. So this connection of, and misinformation that we know that we've seen projected by Andrew Wakefield and the likes, that MMR causes autism and therefore, developmental delay and something that can be stigmatized in all communities, but also the Somali community. And then this other quote actually looks at, actually explains another theme, an underlying theme that we're seeing, that many families are not just, putting a full stop to taking the MMR vaccine. So he's saying, I'm planning to give it to the younger ones once they're 3 years of age. So many families want reassurance that my child is typically developing, they are speaking, there's nothing that, there's nothing wrong with them. And at that point, it's not that I'm just going to completely take MMR off the table, but I will reconsider.
Oh, yeah.
Oh.
We didn't go on there very much though.
I think there might be someone who's unmuted. So just saying that, I'm going to plan to give it to them when it's older. And that is really one important reason for continuing to have conversations about vaccines, even when kids are far behind. Delving a little bit deeper into MMR vaccine misinformation, I think I can, one thing that I'd like to stress with all providers that is caring for Somali patients in the West is that in Minnesota, in Seattle, in many other cities where there's a huge Somali prevalence, MMR vaccine misinformation was targeted. So it did not just come to the Somali community by chance. The community did not all of a sudden decide, okay, we're not going to like the MMR vaccine. It's a vaccine that folks have been taking for, decades, even prior to migration. However, there was a time when many families, especially in the Minnesota community, whereas there's the largest population of Somalis outside of Somalia, were concerned about increasing autism diagnoses, and they did not know exactly why this was occurring. And groups of anti-vaxxers really capitalized on this community concern where, providers were honest. We don't know exactly what causes autism, and it was, this was many years ago. And anti-vaxxers said, well, we do. It's this vaccine. So the community was really targeted in that way. There were multiple community visits by prominent anti-vaxxers in the Minnesota community, including Andrew Wakefield. And as we had said, the Somali community is connected globally. So as this was happening in Minnesota, we were hearing about it in Seattle, in Columbus, Ohio, in Texas, in Australia. So anywhere Somalis live, people were hearing about this. And then this led to drastically declined vaccination rates. I'll show you a slide that has old data, but I think it's important data to see next. So this was the result of the targeted MMR vaccine misinformation. So as you see in 2004, Somali communities started arriving and migrating to the United States early 90s, so 93, 94, 95 is when it really started picking up. So up until 2004 in Minnesota, the Somali community was actually getting vaccinated with MMR vaccine at a higher rate than non-Somali comparison. So if they compared it to the general US-born population, Somali Americans were getting vaccinated with MMR at 92%, whereas the rest of the general population was at 88%. And then shortly thereafter, with vaccine information, with concerns about development, et cetera, you started to see this steep decline. And as you can kind of see, 2008, 2009 is when that really spiked. The decline spiked and people really stopped vaccinating. In 2014, the rate was down to 42%. And then shortly thereafter, there was a big measles outbreak in the Somali community. So this is, again, it's not by chance, it's a result of targeted misinformation in the community. Another key theme that it came up, and I think in the past 3, 4, 5 years, I would say the past 3 to 4 years for the COVID-19 pandemic, but even prior to that for new vaccines, the concern is that, people were not familiar with the process of specifically the COVID-19 vaccine. And even when we don't ask about it, now it comes up and many families are saying, we're really concerned with how quickly this was developed. So families who, these 2 quotes came from our most recent focus groups, and it said, I didn't really think about that for the COVID-19 vaccine. And that is the concern. As you know, I didn't think about that. And by that, they're referring to vaccinating themselves. As you know, it was developed in an emergency, and am I an animal for them to test these emergency vaccines on? So I didn't take it, and I didn't do any research with regards to it. And that I think really encapsulates most of the community's concerns. At the time for the COVID-19 vaccine, there were a lot of other concerns, including, it will lead to negative side effects that we don't know about 2-3 years down the line. I think the microchipping that came up in every community, but also infertility, things that are very important to the family life in Somalis, that it would damage kids, it would lead to infertility, and it took a lot of one-on-one conversations, including, a lot of personal stories, which matter a lot to the community members, of, Dr. Ahmed saying why he vaccinated his children, why his wife got vaccinated. I was a breastfeeding mother at the time, and I told the community that I got vaccinated, and, it did give them pause, saying, well, maybe there isn't, as much worry if you are vaccinating yourself while you're breastfeeding, or if your family members are getting vaccinated while they're pregnant. So, I think that the tide has turned a little bit for the COVID-19 vaccine in the community, but I think this is something that we will continue to see if there are any recommendations changed with regards to vaccinating in general. And one of the things that is starting to come up in clinic right now is the new Washington State recommendation to start vaccinating for HPV at 9 instead of 11. I think that these conversations will come up again. Why is there a change? Are we being guinea pigs? Is this something that's being tested rather than something that we know is tried and true? As we discussed earlier, religious concerns, specifically because Somalia is a Muslim majority country, come up, and they do come up often. And the concern is that there is porcine gelatin that is used in vaccines, which is true. There are vaccines such as, we know for sure MMR, but there are various other vaccines, including flu vaccines that contain porcine gelatin. Porcine, anything that comes from a pig is impermissible in Islam unless there is no other alternative and it's important for your health. So although there is porcine gelatin in MMR vaccines, multiple decrees, so fatwas, have been given from Muslim scholars stating that vaccines are permissible, even if they contain porcine gelatin. So I think the first one that came out was all the way back in 2002, was one that was really spread within the community, showing that, the religious scholars have agreed that this is permissible. Because the chemical transformation of the porcine is so significantly and has changed the porcine significantly enough that it is no longer a concern. The second is that there is no other alternative, right? And the risk is quite high to not vaccinate yourself against MMR. So that makes it permissible. And third is that this is not an oral medication, it's an injection. So you are not consuming anything that's porcine, you are injecting it into your body, which the scholars have said there is a differentiation. So a lot of our reassurance really comes from saying that, saying and knowing that there is a religious decree that has been given by scholars that gives permissibility for porcine gelatin containing vaccines to be taken by Muslim individuals. And then another last theme that has come up, and I think it's come up time and time again, and it's also as a, selfishly as a physician, this is something I struggle with in the clinic as well. Families are often saying it's really hard to feel reassured and have these longer conversations when we know that appointment times are limited. So if my provider has 10-15 minutes in front of me, then it becomes increasingly difficult to have a longer conversation and have all of my questions answered about a particular vaccine if there's other things we also need to discuss. They have continually said that increased provider time and these longitudinal conversations with providers, with the same provider, as you build up a relationship with them, is really helpful, as they know, as that trust relationship is being built, they are able to open up more and more about their concerns. Whereas when you have a shorter appointment time and not as much time to get to know that provider, it's hard to be that vulnerable and say, here is my knowledge gap and here's what I'm worried about, and have enough time for that provider to sit with you, reassure you, and answer the actual question that you have, even if it feels like this might be a low-level question. All right. So we have also asked families really about the sources of information for vaccines and vaccine schedules, because families were really, they were getting information from places and we wanted to know where they were getting it from so we could help counter that misinformation, or, encourage the good information that they were collecting. So far and away, we were really excited and reassured to know that families were getting a lot of their information and relying to get a lot of their information from primary care providers or health systems. So whoever they're seeing and have that doctor-patient relationship with. However, as this day, as is normal for this day and age, there's a lot of online information running around, and social media platforms have this huge pull in the community, specifically WhatsApp groups. There are WhatsApp groups that have thousands of people on them, hundreds of people on them, and misinformation can spread really fast if there is a particular thing or concept being shared, because the reach is so wide. Increasingly, everyone, including the older folks in the community, are really into sharing TikTok videos, because it's these short fragments that tell you one or two things. And really, there's no way to check, if there's evidence behind this. Is this person reliable? Is this person doing it for likes and shares? And I think we saw that a lot, even with like the COVID-19 vaccines, when community members were like, is this true? This woman says she's like, has persistent right hand shaking after this COVID-19 thing. So for us in the community, it was really important to get into these social media outlets to really see what the community is seeing, so that we can develop content that counters it. And then there's a lot of Facebook posts and groups, but the community really appreciates things that do not rely on literacy, specifically English literacy, because we are an oral community. So WhatsApp groups where audio voices can be recorded and forwarded, and TikTok, videos that are small, short clips have been really the most popular. And then as we do a lot of these community conversations, we ask, why are you missing? If you are not vaccine hesitant, or if you are not, resistant to vaccines, what are other reasons for missing vaccines? And there is a huge perception that if a child is ill in any manner, that they should not be getting vaccines. So people will often go, they lead busy lives. They'll go to a doctor's appointment. They'll have a mild cold without a fever, and they will decline vaccines that day because they feel that the child's body cannot handle getting vaccines, even if they're on day 4, 5, 6 of a cold. And then, because again, they live busy lives, they're not able to make that follow-up appointment until the next well child check, which, at some ages, that is 6 months to a year. When they're younger, of course, they're coming in much more frequently. Adverse reactions that are reported by others is a common theme. The age of a child, many families are hesitant to vaccinate a child with, 4, 5, 6 vaccines if they're very young, under the age of 1. distrust of the MMR vaccine, which we've discussed, and then fear of negative outcomes. So, that anti-vaccine research and, specifically not knowing what could happen, what are side effects, and what are side effects that providers might not necessarily be telling patients about. All right. And then so we wanted to talk a little bit about opportunities for partnership and improvement, and I'll hand it back over to Dr. Ali.
Thank you, Anisa. So what are some of the opportunities for partnership for improvement, particularly with your patient? But before I proceed to the next segment, if you have any questions, please, you can drop it into the chat. I'm sure Marina will be monitoring that. Along with that, there's a couple of things that Dr. Anisa had mentioned, including anti-vaccine groups that particularly target the Somali community. We've actually seen this in real time during COVID vaccine efforts we had in the past, whereby during our live Facebook sessions or anything we post on Facebook, there are anti-vaccine groups that would actually post anti-vaccine materials in there. And the community will always review those things and ask more questions about in relation to a lot of those things that are posted. So the patients who you're having in the clinic sometimes come into your clinic with a lot of misinformation. So it's important that you have that conversations kindly with them and continuously as well. But then I also emphasize on other aspects of community building. As an organization, initially when we started the work that we do here in King County, there are not that many healthcare professionals that are Somali, but now that we have a lot of them that have graduated from universities, whether it's nurses, doctors, public health professionals. So I oftentimes emphasize that if you are serving a large population of Somali patients, then at least create that opportunity for some of the health professions to work within your clinics and offices, and that oftentimes reduces some misinformation. This is as a healthcare professional, one of the things that we took upon ourselves early on. This is about almost 9 years ago. There was a lot of misinformation about during the swine flu pandemic. A lot of the Somali communities decided that they do not want to take the vaccine because of misinterpretation or mistranslations about the swine flu, where there was an indication from the community that this was particularly related to pork or bacon, along those lines. So we decided that we'll have that conversation with the community, not only have the conversation with the community, but we'll actually have the imams of the mosque to give vaccine of the flu vaccine the following season. And this is the imam of the largest mosque in Washington State, Sheikh Ahmed Ali, who I actually personally vaccinated. And that sort of reduced some of the misinformation in regards to the vaccines in general and influenza vaccines in particular. But that was not the end of the discussion when we talk about other vaccines as well. So providers need to be aware of their community's specific needs and assets. When I talk about community needs and assets, we often talk about needs, but we're not talking about what are some of the things that the community can bring to the table. And a little briefly discussed about early on, where we talk about health professionals that work in the community. In some of the focus group discussions that we had recently, utilizing the assets to support the addressing the needs include collaborating with trusted community healthcare providers, that includes the Somali Health Board, or even other community organizations that you work with or have connected with, to address some of the vaccine hesitancy issues. Sometimes it might be just having a conversation in one of their discussion platforms, showing up to the community events along those lines. There was a quote that we included in here from one of the parents that said, "So when my doctor told me that I was eligible for COVID-19 vaccine, I let her know that I was going to think about before deciding on whether to get it or not, from which manufacturer. Then I came back to my community and started asking questions about the vaccines and the different manufacturers, and then took the one that the manufacturer that was most recommended by community members." So clearly indicates that yes, they value the providers and will always heed their doctor's information. But at the same time, there's also another trust level that has already been built within the community. There has been issues that the community has faced in the past, and they will always come back and tell you, "Yeah, I'll come back and get it next time when I have an appointment, or when my child has an appointment, we'll come and talk about it." We saw a lot of this during the COVID vaccines period as well, whereby Dr. Anisa Ibrahim, myself, and others actually were one of some of the first few individuals to get vaccinated. And we produced short clip videos that were circulating within the community. From a personal experience, I had actually one of my patients walk into the pharmacy a week later after they saw my video, me getting COVID vaccine, and just walked in and asked, "Hey, I just wanted to see if you're doing okay after you've received the vaccine," because they had received so much misinformation, and it wasn't just the Somali community; it was all across the country. We had a lot of misinformation that was going on. This is one of our nurses that was going into specific community events through the Somali Health Board in partnership with King County Public Health. We were actually going to schools and community centers where a large number of the Somali and Black community were, to make sure that they get the vaccines. And this is one of our nurses, who was actually vaccinating a lot of the families there. Now, this reflects the community itself. You do see someone that looks like them, someone that speaks their language, that can answer the questions for them. A lot of these questions came up whereby during the month of Ramadan, we're still vaccinating folks, and some of the Uber drivers and taxi drivers who are very much concerned about, well, I'm going to be driving all day, but at the same time, it's also Ramadan. Should I also be getting vaccinated? If we're someone who's not well versed in terms of understanding the religious needs of the community, understanding the cultural aspect of that particular community, you don't have to be a religious individual, but at the same time, just knowing that as a Muslim, you can take vaccines, and it's not going to break your fast. Made it a very simple recommendation for a lot of the folks who are coming there. That day, we actually ended up vaccinating over 600 Uber and taxi drivers, who majority of them are Muslim, Somali speaking. If the Somali Health Board was not there, or these professionals were not there, these nurses were not there, I don't think that many of them would have got the vaccine that day. Provide education. I think continuous education for your patients, it's key. Building on the individual's prior knowledge, where you discussed in the past, and understand the vaccine they may have been received back home, to push back against misinformation or disinformation. Because sometimes, as Dr. Anisa had mentioned early on, sometimes folks forget, their parents got vaccinated with the MMR. Everyone who was in Somalia received all the required vaccines as a child and adult. But when we came here, there's so many groups who are pushing different agendas as well. So that is the key to making sure that families understand you are vaccinated when you are in the refugee camps or in Somalia. Now, when you come here, your kids also need to be vaccinated. You need to protect yourself as well. There's a quote from one of the parents that said, "Yes, I did receive vaccines in Somalia and was familiar with what they are before coming to the US." And this is very common. It's a very common thing where sometimes it's not that people don't want to get the vaccine. It's just that they need reassurance. They need to have conversation with their providers. It might take 1 or 2 sessions for that provider to have an actual conversation with them. And then create a space for building trust relationship with families. I think this is really key. Making sure that you build that rapport. You build that. I think that is with every individual that you care for. It's not just unique to the Somali community, but there is a little bit of a mistrust and this misinformation that has happened in the past, and that should be something that provider needs to take a little bit of more time explaining to their patients or the parents of the child they're taking care of. Explain the vaccine and make farm recommendations. I think this is key, making farm recommendations. Sometimes we just give a leaflet, we give them the information, vaccine information sheet, and they take it home. But I think recommending to the family, recommending to the mother and the child and the parents, letting them know that this is why you're protecting your child. This is what's going to protect from them, whether it's measles or other vaccines, routine vaccines. Make them understand how contagious vaccine is, the disease is, and why it's important that when the kids start school, they're required to get those vaccines. Start off, some of the quote that we received, start off by asking the doctor about the vaccines, what it is, what disease it prevents, how it will affect my child. And if that's the discussion, I'm convinced that it is something that my child needs for their health and will be being, then I will give it to them. I think this is one of the mothers that had discussed this in our focus group session. I also do recall a father who had 4 kids. 2 of the older kids were fully vaccinated, including MMR, And then the younger ones, during the pandemic, the two little ones were not vaccinated, so they moved, the entire family moved to Kenya for a period of time. Unfortunately, the little ones contracted measles and were very sick for some time, according to what the parents was telling us. They came back after the kids were treated. They came back, but the father was actually very grateful the fact that he did not vaccinate, or the kids were not vaccinated with the MMR vaccine, and has been an advocate for other parents to make sure that make sure their kids are vaccinated, because he can relate to both aspects of making, kids who are, the two of the older ones were vaccinated and the younger ones who are not vaccinated who became sick.
Yeah, Ahmed, I just wanted to add very quickly to make the concept of making a firm recommendation is really, really important. I mean, the Somali community has been here for nearly 30 years now. However, most are still navigating that shared decision making that we find so common in Western medicine. So if many have said, when I just say no, thank you, many doctors will say, okay, so how important are these vaccines if the doctor is actually not pushing back against what I'm saying, or continuing to make a firm recommendation while saying, I do respect your decision. However, I wanted to make this firm recommendation. And I have parents who, ask me this all the time, do you recommend this vaccine? And I make a very firm recommendation saying, like, here are the vaccines that your child is due for today. I make the firm recommendation saying I recommend that they receive all these vaccines today. However, because of the relationship, they know that I'm willing and open to having this discussion with them. And I have families who every single visit they come, they'll be like, I'm here for ear infection. We're going to talk about the MMR vaccine, aren't we? And I'm like, well, yes, you still haven't gotten it. What questions can I answer, et cetera. And that firm recommendation, I do think, goes a long way, and it does not send mixed signals about how important a particular vaccine is when the families are still deliberating.
Absolutely. Thank you, Anisa, for chiming in. I think one of the other aspects is also, as a parent, oftentimes I let them know, did I take the vaccine myself, or did I give that vaccine to my children? That's also key as a parent to understand that you are coming from a perspective on knowing that, you're vaccinating your own children, and you understand why your child should be getting those vaccines. So even going to that point whereby you're being firm with the parents and giving them that firm recommendation, also be intentional. Allow them time for ongoing discussions. There was always going to be that parent, that parent that feels like, I have more questions. I'm going to be asking more before I actually get to that level of comfort. And while you are giving the firm recommendation, we also want to make sure that you are giving that opportunity for that parent to ask questions, come back again, and at the same time, vaccine the children in the timely manner. There's going to be cases whereby, I'm sure, Anisa, you've seen yourself, where, the scheduling, there's been discussions where some of the families will say, well, I'm going to not necessarily follow the specific recommendations that the CDC guidelines are, but I'm going to make sure the kids are vaccinated because of my own personal concerns about X. I'll vaccinate the kids, but I'm going to skip a month and come back the following month, along those lines. So, being intentional, allowing time for discussions is key. I think giving them an understanding that you are in control, but at the same time, this is your child's health, and this is the reason why you have to make sure your kids vaccinated. One of the parents said, I think taking the time to educate and help them understand the truth about vaccines and why they entail is a great way to make families comfortable, emphasizing on the positive impacts of vaccines, doing it in a kind manner, no harshness, and with cultural humility. I mean, we're going back to the same discussion whereby we're giving that understanding that, listen, you've got to vaccinate your child, but at the same time, we'll have this conversation if need be, and we can answer more questions as it fits. So what are some of the concerns that you can work with your parents, help parents to overcome some of the concerns that we've identified through the focus group discussions, as well as some of in the past conversations we have with the family. And this includes working with mom-to-be. And we're emphasizing the mom because a lot of times it's the mother that's going to bring the child to the vaccine clinics. The dad will accompany them, but it's oftentimes as a community that Somali community, oftentimes the mother is the decision making a lot of the health needs of the community, including the father. They make a lot of decisions for the dad to get to their appointments and make up along those lines. Early engagement of pediatrician. I think the pediatrician needs to start these conversations early on, before you start, specific vaccines. And I think there was, some recommendations about probably 3 months before you talk about specific vaccines that are coming up. Should be able to do that. Engage the patient on an ongoing conversation. Encourage the parents to be more proactive. There are some parents who are willing to talk and do their own research and come back prepared with why the vaccines needs to be given to the children. But at the same time, if you're providing these materials, be encouraging those parents to do that as well. Engage religious leaders if need be. I'm sure some of you will not be in that position, but at the same time, if you have any questions, it's always great to talk to the local mosque, talk to the religious leaders in the community and the organizations that are serving the community that we're speaking of as well. Many of our religious leaders, I think all of them are in the same notion and understanding about the prevention. In Islam, prevention is better than cure, and that's oftentimes emphasized. During the COVID discussions, we had a weekly COVID conversations with the Somali community. Aside from us healthcare professionals who are talking about the COVID in general and the vaccines, we had an imam from the mosque who was actually there to talk about the religious obligations of a Muslim individual to protect their body, to make sure that they take care of their health and their requirements in that context. Anisa, is there anything you want to add to this?
No, I think I really love to emphasize that last part, engaging community leaders and organizations. Often we think about vaccines just being something that we are giving at wellness visits, either family medicine, pediatrics, you build that relationship, but often community members are relying on many other relationships to be making this decision. So, from this slide, I think, if you were to say what is the main point, it's really build a good relationship with the mother, because mothers are the decision makers for health in the community far and away. And then 2, it's really looking at the work that other community organizations are doing, because once they leave the office, that's where the families are going to be leaning on for information, for guidance, and for just further discussions to really help make that decision about vaccinating or not.
Great. And then the last piece before we conclude is how parents follow CDC vaccine schedules. I think this is key, and oftentimes this depends on the healthcare system and the providers. Reminders. Sometimes we've shown patients who don't show up to their appointments because maybe they didn't receive the phone call as a reminder or text message, however system you utilize. Using the interpreters to make sure that they follow up with them for the upcoming appointments. That way, make sure that the kid gets the vaccine that they need to get on time. Provide parents with the vaccine information following each visit, given in the handouts. And I think I briefly touched about this early on, providing as much information as you can, or even giving them as an oral society, sometimes directing them to short clip videos that talk about the vaccine itself that the child should be getting in the coming visit. For example, even handout to discuss 12-month vaccine at 9th-month visit, and not waiting the time that they walk into the clinic and tell them, surprise, well, your child is due for X, Y, and Z vaccines. That kind of throws off at the parent. And I think as a pediatrician, Anisa, you probably have a couple of things to say about that. And then discussing ahead of time vaccines is really, really important. I think having this conversation on an ongoing basis, as it relates to the parent. For the parents, each parent wants to protect the child. They want to make sure the child is healthy. But having these conversations early on is really, really important as well. Anisa, you have anything to add to that?
Yeah, so I'll just add 2 things. I think the point about vaccine information at the following visit has been key for me to be able to have these discussions in short periods of time. As we know, the face-to-face provider time is always limited during a wellness visit or during the time a child is coming. So often, when I start talking about the 2-month vaccines, I kind of give them an overview, right? Like, we're going to start vaccinating 2 months. Here are the vaccines we're vaccinating with today. You can expect to get the same vaccines at the 2, 4 and 6 month visit. If it's the flu season, I start talking about flu vaccine. At the 9 month visit, typically that is a visit that's a little bit lighter when it comes to vaccines. And then, we're looking at 12 and 15 months where there's a lot of vaccines, many of which the child has not had before. So then I start to discuss, 9 months is when you kind of get a break a little bit, depending on what season it is. But at the 12-month visit, here are the vaccines that we're going to be planning to give. And then that way the family comes prepared and are able to actually think forward and see what vaccines am I going to be due for? Do I have any questions? Do I need to consult with somebody? So you can really maximize the ability to vaccinate at that next visit. And then I think it by far, like I said, the community is vaccine deliberate, possibly hesitant. So keeping the conversation open is really, really important. And making every single time that person is in front of you a reason to ask about, do you want to vaccinate now? What questions do you have? What can I help? What can I do to help alleviate? Because I've been unable to predict when a family will finally turn, right? There's some things when you can predict. When there was a mumps outbreak in Auburn, a lot of families started to come in and say, yes, I'll vaccinate now. But other times it's just a family who's saying, I've been with you for long enough. You continue to recommend this. I feel comfortable today. And nothing was different about today, other than the fact that I brought it up again. So there is an importance in continuing to ask and not, and never take vaccine discussions off the table. Of course, again, that's generalizable, but I think it's really, really important. Sherry Zorn, I hear you. Are there specific concerns that cause HPV hesitancy? So the concerns in the community for HPV vaccine hesitancy specifically is that again, it's a little bit of a newer vaccine, but far and away, I think that the bigger concern is that my child does not need the vaccine right now, because again, it's preventing something that is technically transmissible through sexual contact. So there is this avoidance of let's not talk about these things until they're older, until they actually are facing are faced with these issues. A lot of families really hold dear their Muslim identity and say, these are things that we're not discussing with our children yet. They're not going to be sexually active for a while. So why are we vaccinating at such a young age? When we've done a lot of work with vaccine hesitancy, both in the East African community in general, but also within the Somali community. And the way that we have addressed these concerns is really thinking about, again, using that prevention model that is both culturally important, but also religiously important, prevention being better than cure. So we really discussed that HPV is so prevalent in adults that you want to make sure that your child is well protected before they've ever had the opportunity to come in contact with HPV. So, really removing this, trying to push aside this concept of looking at HPV as a sexually transmitted infection, or something that is transmitted with sexual activity, and more so you want to be protected from this way before their child ever comes in contact with it. The other thing is really differentiating it from HIV, right? Like there is a 1-letter difference between these diseases, and it's very easy to put them both into one bucket and say HPV, HIV, like, no, the risk, the perceived risk can be seen as low. So they can see it as like a vaccine that, is an extra vaccine, or a vaccine that we keep trying to just push in. So that has been another thing. And then the last thing I think is, I think it's better now, but in the medical system, we were really recommending HPV as a separate thing, right? And then do you want the HPV vaccine? Because it's not required by schools, et cetera. And I think bundling it, as has been recommended by, many people, including, I think it was Dr. Doug Opal as well, once before, saying, here's the 11-year-old vaccines. Now I know we've pushed it to 9, but it's tetanus, it's meningococcal, it's HPV, and not really differentiating it from the other vaccines. So not considering it an other.
Great. I think we'll let the next few couple minutes for folks to come in and ask any questions they might have. Marina, if there's anything that you want to share, we can happy to discuss that as well.
I would love to hear any questions. Thank you guys. I think I really appreciated the focus on the strong recommendations as well. I think I've been hearing that a lot from all the different sources, just strong recommendations across the board. So it's helpful to hear you talk through how you would actually share that with the patient. Oh, I do have a question for you both. You were mentioning at the end of the visit, providing materials for the patient to take with them that might educate further. Do you know of a good place to find like educational materials in Somali?
So I feel like we've relied on a couple of different, sorry, I'm also trying to look at in the chat. We've relied on a couple of different things. We've done a lot of kind of public education with regarding to orienting families to what the VIS looks like, the vaccine information sheet. In clinics, many clinics, the VIS is available in Somali and many other languages through the CDC. Typically, we're used to giving the vaccine information sheet after we vaccinated a child, right? We're going to vaccinate your child with Tdap, here's the vaccine information sheet. And I'm really a proponent for if a family is hesitant, printing out those VISs in English, in Somali, and then because we're an oral society, if you hand someone a piece of paper, myself and Ahmed included, we're walking out of that doctor's office, we're tucking it in our bag and we're calling it a day. So when you hand someone something, it's really important to kind of orient them to it. So I often will hand a VIS and say, here's information about the MMR vaccine. And here is, here's information about the varicella vaccine. This page essentially goes over, what is this vaccine? What are side effects? Like, what are things that, what does it protect against? And then handing it to the family and saying, I want you to think about this when you come in for your next visit. We have that comic book that we developed through the Somali Health Board. It is in English and in Somali, but it's more kind of like a conversation, a typical conversation that some people might have. And it's been a nice way for the community to connect with this conversation. Again, it is written, so it does, it does not factor in literacy. And then there have been a couple of videos that the Somali Health Board has produced. Again, some of them are particular to one vaccine or another. So depending on what the family has expressed interest in, there is things up on the Somali Health Board, both Facebook page, but then also on the website.
Thank you. I'm looking at some questions in the chat here. So from Molly Capron, she says, I mentioned that Muslim religious leaders have issued fatwas stating that gelatin containing vaccines are okay. They often tell me that those are not the leaders they listen to. It's their own imam or leader. Any advice?
I think the advice is that they follow with their local imam as well, because I think the fatwa is, when you talk about fatwa, this a religious ruling that affects all Muslims across the globe, right? But then there are local mosques that oftentimes also folks go there and seek advice, religious advice. I'm not aware of any Muslim imam that would actually be anti-vaccine or will tell his his congregants that not to get their kids vaccinated or not to vaccinate themselves. I think when a patient talks about, hey, those are not the fatwas that I follow, then you do ask a question, which mosque do you go to? Because that imam, most likely, if they're here in King County, Washington State, is actually telling their congregants that vaccination is allowed and it's permissible for a Muslim person to get vaccinated. We've had multiple discussions with imams all across the county, and we've not come across a single imam that actually says it's not permissible for someone to get vaccinated. So maybe just pushing that back a little bit and saying, well, the local imams here in Washington State do indicate that people get vaccinated. And maybe next time when you come back, let me know what your imam tells you, because they do have a homework to do and follow up, because that's not clearly within the guidelines of Islam.
Yeah, and Molly, I put it in the chat, but we both individually and through the Somali Health Board have partnered really with all the major masjids or mosques in the Seattle region that Somalis frequent, including Abu Bakr, Al Nur, Muslim. MAIF, I always forget the MAIF acronym, Muslim American Foundation. And MAPS, which is not Somali, but is the Muslim Association of Puget Sound. And we have not come across a single one that has called vaccines haram or impermissible.
Thank you for that. Another question was, from Frank Bell, other than porcine-derived gelatin for us as non-Muslim providers? Are there other religious concerns that we should be aware of?
Honestly, none that we have come across. Most of it has really come back to the porcine derived ones. There have been some families like, wait, when I say like 10 years ago now, at some point they were concerned about research in embryos and whether there is dead fetuses used in these vaccines, and that I feel like has essentially quelled down, and not many people have said that they're worried about that now. And then again, with the HPV vaccine, it's not a religious concern per se, but it's more kind of like cultural parental ideals of like, I don't want to be introducing this vaccine, because what if my child sees it as a signal to signal of like, maybe you can be sexually active, or we're talking about a sexually transmitted infection rather than the prevention of a sexually transmitted infection. Have you noticed anything else, Ahmed? Those are the three that I've seen.
Actually, you covered it. I have not seen anything else aside from that. But it's also worth noting as the healthcare providers that when we're talking about gelatin in itself, it's a very small number of folks who have a concern about that. And many manufacturers actually have there are different manufacturers that produce different vaccines, or let's say influenza, that don't contain gelatin. I think it's just a matter of just doing homework and figure out which of those don't do that, and have your clinic carry that as well.
And I know you touched on this. I wanted to repeat this for everyone too, if you didn't hear. With Ramadan, it sounds like it's safe to give vaccines then. I was shadowing and it wasn't clear between the MA and patient if that was okay. So I'm glad to hear from you all and from the community that it's acceptable. It looks like Neighbor Care carries the MMR without porcine. That's great. Any other questions? We're just at one here. All right, well, thank you both for your time and for sharing. This was wonderful to learn. I think we can all agree that you guys did a wonderful job.
Thank you so much. It's a pleasure to be here and see lots of familiar faces. Appreciate it.
Enjoy the rest of your days, everyone. Thank you.
Thanks, everyone. Have a good one.
All right, thank you.